Jotna lamsoko GK and nursing exam channel CHO examination bagai important question to pekanang bagai. Phaidinai question. Question number 1. Primary health center established by which committee? Answer: Board Committee. Board Committee established 1946, known as the Health Survey Development Committee. Next question. Sub-center also known as Health and Wellness Center. Next, the first referral unit is Community Health Center. Next, International Committee Red Cross Society Headquarters, Geneva, Switzerland, founded by Henry Dunant, 1864. Indian Red Cross Society Headquarters, New Delhi, established 1920. Next, the main objective of mid-day meal scheme are to increase enrollment of children belonging to disadvantaged section in schools, to increase the attendance of the children in government and government-aided schools. The meal should supply at least 1/3 of the total energy requirement and half of the protein need, to retain the children studying in class 1 to 8. Mid-day meal program katalbumong PM Poshon scheme. Next, school health checkup comes under School Health Committee. Next, National Mental Health Implementation in 1982. Children's Day 14 November. World Diabetes Day 14 November celebrate. Next, in UNICEF's GUPI campaign, O stands for Oral Rehydration Solution. GUPI full form: G. Growth chart. O. Oral rehydration. B. Breastfeeding. I. Immunization. UNICEF headquarters New York, established 11 December 1946. UNICEF full form: United Nations International Children's Emergency Fund. Next question. In IMNCI color code case management strategy, pink color indicated. Answer: child need drug and inpatient care. Mostly serious infection need for refer. Yellow color indicate kayo child need specific treatment, initiation of treatment in health facility. IMNCI full form: Integrated Management of Neonatal and Childhood Illness. Next, which solution is used to kill the corona? Sodium hypochlorite. Sodium hypochlorite use खाइजाको HIV positive patient ni blood no wash खाइना बागै. Next question. SARS full form: Severe Acute Respiratory Syndrome. MERS. MERS cough. Full form का Middle East Respiratory Syndrome. Next, botulism disease caused by Clostridium botulinum bacteria. Next question. Classical dengue fever is transmitted by Aedes mosquito. 15. Population covered by an Anganwadi worker 1000. Next, outbreak of disease in the community in excess the normal expectation is. Answer: epidemic. Worldwide spread pandemic. Example: COVID-19. Next, full form of ASA: Accredited Social Health Activist. Next, following are the contents of ORS except option number A, potassium citrate, B, sodium chloride, C, glucose, D, sodium citrate. Answer A, potassium citrate. Composition of ORS are sodium chloride 2.6 gram per liter, glucose 13.5 gram per liter, potassium chloride 1.5 gram per liter, sodium citrate 2.9 gram per liter. Next question. Kubler-Ross 5 successive stages of death and dying are. Answer: denial, anger, bargaining, depression, acceptance. Abra hino dabda. Next, which of the following is the zoonotic disease? A. Chikungunya. B. Malaria. C. Rabies. D. AIDS. Answer: C. Rabies. Next, most dangerous causative agent for malaria is Plasmodium falciparum. Next question, contraceptive method to prevent ovulation. Answer: hormonal. Next, anti-tubercular drug contraindication during pregnancy is answer: streptomycin. Streptomycin complication, ototoxicity, damage to the 8th cranial nerve, hearing loss. Anti-tubercular drugs are isoniazid, complication vitamin B6 deficiency khayo, sideroblastic anemia deficient anemia cause khayo. The next rifampicin. Rifampicin complication, red orange color urine. Ethambutol complication, eye বা optic nerve damage khayo. Next question, Neglis formula used for answer EDD, expected date of delivery. Next, community health center serve as a referral center for dash PHC. Koite PHC ne serve for PHC. Next, Mission Parivar Vikas launch. Answer: 2016, aim family planning. Next, rotavirus vaccine launch. Answer: 26 March 2016. Route of administration के oral 5 drops करना है. मुफ्त देना है at 6 weeks, 10 weeks and 14 weeks to prevent diarrhea. Rotavirus vaccine का life attenuated vaccine. Next, Ayushman Bharat launch होगा 23 September 2018. Next, nationwide rollout Pradhan Mantri Digital Health Mission was done on 27 September 2021. Next, National Immunization Day 16 March. What is mucormycosis? Mucormycosis is a fungus infection or black fungus caused by mucormycetes. Next question, when India crosses 100 crore COVID-19 vaccination does milestone? Answer: 21st October 2021. Next, dose of vitamin A prophylaxis for control of blindness in children below 6 years is answer: 2 lakh international unit. Vitamin A first dose 1 lakh international unit at 9 months and vitamin A ni total dose 9 dose every 6 months and total 17 lakh international unit reject mein. Next question, average duration of first stage of labor in primary gravida is 12 hours, multiple 6 hours. Next, one of the major cause of maternal mortality in India is hemorrhage. Next, what is the main aim of Janani Suraksha Yojana, which is a program by the Family Welfare Program? Answer: reducing maternal and neonatal mortality. JSY launched on 12 April 2005. Next, the syphilis caused by answer: Treponema pallidum bacteria. Syphilis is a sexual transmitted disease. Syphilis drug of choice penicillin. Next, stage of labor. First stage true labor pain to dilatation of cervix. Second stage full dilatation of cervix to expulsion of baby. Third stage expulsion of baby to expulsion of placenta. Fourth stage observation. To next, umbilical cord cutting time. Answer: 1 to 3 minutes. First clamp 2 finger above abdomen. Second clamp 5 finger above abdomen. Next, what is lochia? Lochia is a vaginal discharge after giving birth containing blood, mucus and uterine tissue. Types of lochia: lochia rubra, is bloody red color postpartum vaginal discharge during the first 4 days, 1 to 4 days, containing blood, decidua, barnix gaseosa, meconium, fetal membrane. Lochia cirrhosa is a thin, watery yellow and pale brown or pink color, 5 to 9 days, containing less RBC, more leukocytes, serous exudate, mucus, microorganisms. Lochia alba is a pale white, 10 to 15 days, contains decidual cells, leukocytes, mucus, fatty tissue. Next, what is the normal size of the uterus? 7.5 into 5 into 1.25 centimeter. The normal uterus weight non-pregnant, answer 60 gram. Next, ovulation occurs 14 days before next menstruation. Next, a woman who never gives in birth to a child is called nullipara. Next, episiotomy has to be done during second stage of labor. Next question, increased pigmentation in the face during pregnancy is called, answer chloasma. Next, a pregnant woman should visit the antenatal clinic twice a month during pregnancy, answer 8 months. Next, the weekly iron and folic acid supplementation WIFS program is meant for option A, adolescent girls and a lactating mother, adolescent boys and pregnant women and lactating mother. Option C, adolescent boys and girls, D, pregnant women. Answer C, adolescent boys and girls. Next question, Pradhan Mantri Surakshit Matritva Abhiyan PMSMA launched to provide fixed, accurate, comprehensive and quality antenatal care universally to all pregnant women is, answer second and third trimester. Next, International Yoga Day 21 June. Next, oral contraceptive packages of Maladi contains, answer 21 oral contraceptive pills and 7 iron tablets. Next, all of the are barrier methods of contraceptive except A, diaphragm, B, Nova T, C, vaginal sponge, D, condom. Answer B, Nova T. Next, National Vector-Borne Disease Program covers the following diseases except A, malaria, B, leprosy, C, chikungunya, D, Japanese encephalitis. Answer B, leprosy. National Vector-Borne Disease Program covers 6 diseases known: malaria, dengue, chikungunya, Japanese encephalitis, lymphatic filariasis, Kala Azar. Next, the Kala Azar fever is transmitted through the bite of, answer sand fly. Kala Azar causative agent leishmaniasis. Next question, all the following infections are caused by RNA virus except A, poliomyelitis, B, mumps, C, rubella, D, smallpox. Answer D, smallpox. Hepatitis B, DNA virus. RNA virus are COVID-19 RNA virus, HIV RNA virus, hepatitis A, C, D, E RNA virus, hepatitis B, DNA virus. Next, hepatitis A and E transferred through fecal-oral via contaminated food, water, direct contact with infected persons. Hepatitis A is also called infectious hepatitis. Hepatitis A te E transfer fecal-oral contaminated food, water transmitting. Next, hepatitis B, C, D transfer through blood. Next, which is the following bleeding disorders? A, leukemia, B. Anemia. C. Hemophilia. D. Leukopenia. Answer C. Hemophilia. Hemophilia is the bleeding disorders. Next, the rate of drug absorption is greatest in the option A. Large intestine. B. Stomach. C. Gallbladder. D. Small intestine. Answer small intestine. The small intestine are duodenum, jejunum, ileum. Large intestine are ascending colon, transverse colon, descending colon, sigmoid colon. Next, scoliosis, sideways curvature. Scoliosis tamna hinge lateral curvature of spine. Kyphosis বা dorsal hump বা hunchback. Kyphosis is outward curvature of thoracic spine. Lordosis is inward curvature of lumbar vertebra. Next, master gland of the endocrine system is pituitary gland. Largest bone femur, smallest bone stapes, bone in the middle ear. Total number of ribs 12 pairs. Most mobile joint ball and socket joint. Example shoulder joint. Total number of bone in human body 206. Axial skeleton 80. Appendicular skeleton 126. Collarbone বা beauty bone বা bone hinge clavicle. Shoulder bone scapula. Breastbone sternum. Which of the following is not cancer? Option A. Glaucoma. B. Leukemia. C. Carcinoma. D. Sarcoma. Answer A. Glaucoma. Next, a group of diseases characterized by abnormal growth of cells capable of invading the adjacent tissues and even distant organs is called A. Hypertension. B. Cancer. C. Coronary artery disease. D. Diabetes mellitus. Answer B. Cancer. Next, when antibodies produced in one body are transferred to another to induce protect against disease called passive immunity. Next, the pellagra is caused due to the deficiency of niacin. Next, a flexible connective tissue that is attached to bone at the joint is called option A. Cartilage. B. Tendon. C. Nerves. D. Muscles. Answer A. Cartilage. Next question. So the time interval between infection of suspected person and the appearance of signs and symptoms of the disease is called answer incubation period. And the next causative organism of measles. Answer paramyxovirus. Incubation period 7 to 21 days. Measles vaccine first dose at 9 months. Second dose 16 to 24 months. 0.5 ml subcutaneous dilute खायो distilled water. Next question. Rubella is also known as German measles. Next, causative organism of chicken pox is varicella zoster. Next, Zika virus transmitted through infected mosquito Aedes aegypti. Next, hepatitis B vaccine first dose given which age? Answer at birth 0.5 ml intramuscular bustus lateralis. 72 number maternal mortality ratio 1 lakh live birth. Next, when did the government of India started NHM? NHM National Health Mission. The National Rural Health Mission different on National Rural Health Mission के 12 April 2005 abo notation National Health Mission ka 2013. Next, if a baby आपका रो score is 8, that means option A moderate distress, B mild distress, C no distress, D none. Answer C no distress. Total आपका रो score 10. 8 to 10 का no distress, 4 to 7 का mild distress, less than 3 का severe distress.